Wonderful pointers there. We are going to go to that lovely topic of challenging our brains late afternoon before lunch with computer science, so interdisciplinary things. We are trying, the aim here is to understand what is machine learning and natural language processing. And before we go there, I would really like to acknowledge the country. This is why I talked about my ethnic background. It has been my true pleasure to live in Canberra for about 12 years now. I pay my respects to the elders, the Ngunnawal and Ngambri people, past, present, and emerging leaders in this country who have looked after their area so well. And I hope that my family can contribute to that. And I would say that the main contribution that we do is through gathering of knowledge from different places and sources, and the bringing together of an even greater collective knowledge system. Beautiful quote related to this beautiful painting that is here at the ANU campus by one of the local Indigenous artists. Does anyone know where that painting is, or where the photo of the painting is from? That sits on the wall of the supercomputer here at the campus. So one of those machines that my job is to make very hot and make sounds and consume. So I'm one of those consumers of the supercomputer with my group. But before we go to that, challenging the brain with computing, let me introduce you to Ellen. She's a Canberran, so proper Australian or Aussie girl. She would hate me if I call that she's a teenager. She's a young person. She loves sports. Here she is playing indoor soccer or futsal. A couple of weeks ago, she had her first trip overseas to play in Spain. When I got to know her, she was still in school. She loves her family, for example, Karen, and we will get to know Karen too. She has a very active community of friends, for example, Lucky or Lachlan here. And like anyone else, I had my last beach fix last weekend before the winter. So of course she wants to go and join the kangaroo and have a holiday at the beach. However, I think before I continue to talk, we should get to know her a little bit better, because there's something else that is important to know.
When I was first diagnosed with type 1 diabetes, I kind of didn't know what it was.
When it's your own child, you know, you're always second guessing whether or not you've got it right, and you know, you're worried that you're going to do something wrong for them.
As health, we put a lot of pressure on the families to achieve good control of diabetes, because we want longevity, we want healthy outcomes for our families and their children.
I was diagnosed with MS when I was in my mid-40s. But with the wisdom of hindsight, and when I learned more about the disease, I realised that I was experiencing symptoms, sensory symptoms and visual symptoms in my early 20s.
Not everyone has the same symptoms. It's not a cookie cutter type disease. Everyone has different symptoms.
Our health in our hands is, I personally think it's a good idea, because it gets researchers to hear from like people like myself firsthand, and like everyone's going to be different in that, but it'll just help them in a way that they can actually see how it affects people and what they can do like in different ways.
I think that the major benefit of our health in our hands is actually owning the fact that we have MS.
It does give people, patients, an opportunity to contribute to the body of knowledge about what is actually happening.
We have a wonderful group of scientists who are very keen to get to know these people for whom they're developing technologies, and that our research is aiming to help.
There's this one saying that I love, it's just, I don't live with diabetes, diabetes lives with me, so it's basically taking control and doing what I want to do.
There she was, taking control, and she has been such a wonderful contributor to our co-creation over the years. There we go. So she wants to have her beach holiday, but there's a beach holiday with a twist. She has an insulin pump, but at beach it's a little bit tricky to operate with that pump. So she's looking into, can I have my beach holiday and also have a holiday from that pump? And clearly her mother is of course worried about that. She's a young adult going holidaying on the beach with her friends, remote location, far away from support, without the insulin pump. So they go to a web search engine, Google in this case, and do a search, pump holiday at the beach. These types of engines, they are called also information access technologies in my field, or information retrieval is a term grouping them, or search engines. So this is a very generic one with which most people use for their information needs. And thankfully it's actually working quite well. There's only a couple of advertisements related to where to stay, but most of it is actually about the topic of having pump holiday at the beach, which was her search. And I found that it's actually pretty remarkable how well the engine works. Then we have specific technologies, information access technologies for healthcare, medicine. Here's one of them that many of us use daily, and in building systematic reviews, Cochrane reviews, this would be probably our first place to go to. When I searched last week when preparing for this talk, pump holiday at beach, I found one study, and I actually think that there's plenty of more, but there is a mismatch or misalignment between the language that our wonderful Ellen is using as a young person living with diabetes and what we scientists tend to use. So that makes my life in computing, building these engines, a little bit more interesting. How can I make it work when language is so rich? Question, I'm not a medical expert. I very rarely have access to patient records. What would happen if I search from patient records, clinical records, medical records, whichever name you wish to use, pump holiday at the beach? How many hits would I get? None. So there's something to be done, I think. Professional and scientific text, it could be said that it's pretty complicated text to understand. It's a genre, like was referred there, where it's used for purpose, as was discussed before, and it's full, for example, of abbreviations and acronyms. So some of these abbreviations and acronyms are easy to understand, like with those that are after numbers. So milligrams, easy one to understand. T1DM, I can even guess that, that's type 1 diabetes mellitus. But FBS, that starts to be tricky. And I just realized during COVID that one of the words that was fully lowercase, no symbol, that it was an acronym in my PhD, puputa in Finnish, which means to eat, that was actually an acronym referring to that exercise where you blow into a bottle in order to clear your lungs. So puhaltaa pulloon, puputtaa. Here's another example from scientific text. This is from the types of methods that I publish on, reinforcement learning, but RL could be so many other things. This is one of the issues in these medical records, what makes them so hard to understand by people. So we have been in the ANU, our Health in Our Hands Grand Challenge initiative, co-creating these technologies by partnering across disciplines, professions, areas of expertise, and I should have had here 2 nations, like we have been talking in this symposium. Here is Karen and Lucky and Ellen, all of them. But I want to ask a question. Who benefits from reliable, readable, and relevant information? Is it our young people, parents, researchers in computing and engineering who might not know the medical genre, so being lay people? Is it the clinicians? Is it the educators, or is it someone else? Who benefits the most? I think that that's a good answer, but there is someone else who I think that benefits even more. I actually think that it's these machines, and now we need to go back. And so this is Sandaru, who is about to submit her PhD.
Sphenopalatine ganglioneuralgia. Brain freeze. When you have cold food, but sphenopalatine ganglioneuralgia. It means brain freeze, the one you get when you have cold food, but it also gave me a brain freeze trying to say that. So let's shorten it and call it SG. But if you're a physicist, SG might mean specific gravity. Another scientist might think of seaborgium, a chemical element. But if you're like me, it would actually mean sounds good. Natural language, it's complex and ambiguous, and the context, it matters a lot. I'm a non-native speaker, and sometimes I find it difficult to understand some words. It's confusing, annoying, and adds so much burden. And when we read scientific papers, sometimes the language is too technical. What about patients who are given unfamiliar health reports and asked to make life-altering decisions? The cost of misunderstanding can be high, and we need expert translators, but human experts are not always available to help. That's when my research comes in. I use artificial intelligence to get computers to help us understand complex and unfamiliar text, but computers can't read text like we do. However, they can read patterns. They read these patterns by converting text into numbers and giving them a location in an imaginary multidimensional space. Like you see on this slide, it's a map of words as computers see them. We call it a vector space. I use language models trained on billions of words, and I write programs to create language models which create these vector spaces. The distance between words in a vector space is extremely important. Words which are together are similar, and words which are far apart are different. For an example, sphenopalatine ganglioneuralgia lies far away from specific gravity or seaborgium. This helps the computer to learn and even differentiate between the possible meanings for SG. Using these, I've developed methods that can scan text and predict which words will confuse you, and provide you with a real-time translator that can help you understand complex and unfamiliar text. Language is evolving rapidly, but with better research, we can help non-native speakers like me, second language learners, students who want to learn science, and even patients who want to know more about their conditions to better understand language, to avoid any misunderstandings and confusions, and of course, to avoid any brain freezes.
So for 10 years until 2021, I used to be co-chairing an e-health challenge. Every year we challenge the world freely on health-related searches in many, many languages, usually 3 tasks per year. All of these resources, they are available online on our website. They go from how to get a computer to help systematic reviewing in medicine, to nursing handover and speech recognition there, filling out medical forms and building these web search engines. As an example, this is where we started in 2012. So we co-created together a problem setting, a scenario. So instead of having that very concise, hard to understand clinical record, how to expand it, add links to definitions, treatment, change terminology. So instead of GERD, one could be talking about heartburn, making these records more accessible. And from that, we continued for 10 years. we became very fast one of the most popular tasks there. So we had over the years almost 1,000 teams with usually 4 people per team register in from every continent. So this was all over the world. The team submitted more than 250 submissions. And sometimes the team submitted multiple things and took part in multiple tasks. We were mirroring the scholarly influence, but the main mission we had was to bring the community together like we have in this symposium, share resources and share best practices, how to evaluate the systems and make sure that people have reliable data sets and problems to work on that have practical relevance. Here's an example of our last task with respect to those search engines. We co-created with Ohio people, 50 topics, collected a massive collection of contents from the internet and social media, had experts to assess if the returned documents are topically relevant to the information need, if the content is easy to understand, and can we trust the information there. Tasks, some of them addressed machine learning specifically. Some of them, these resources have been used for linguistic studies and sometimes for health science resources. And the point here is that the resources are still available and we are very, very happy to support further work on them. Sandaru's work, that text simplification. There's quite a bit there of computing. I don't go to the details of it. The beautiful thing, the main essence here in our main contributions, which is to generating those substitutions and disambiguating acronyms, is that what Sandaru was telling in the video, how to establish an anchor that connects your word to the right context and right type of information as opposed to the wrong type of information. So triplet networks would be the context. Sandaru and us, we have also built a demonstration system that we are trying to evaluate at the moment. We have some studies coming from that one where people can use our models and other people's models. And I have one video to share, but in the interest of time, given I got a 5-minute mark recently, would you be like to perhaps share the link and you can hear from Lucky a couple of minutes another time. He's telling about his experience in co-creation and how rewarding it has been for him to be treated as a part of the research team with us, our academics and clinicians. It's a beautiful endorsement, and that connects Lucky with the storyline. These endorsements are the reason why it keeps me going. Comments like, thank you for giving us hope in a symposium. And indeed, I think that the act of living itself unravels both the answer and the question. Thank you so much.